My name is David De Bandt. I'm a general practitioner and I'm a sonographer. I teach ultrasound for residents in general practice at the University of Versailles-Saint-Quentin. And I would like to present you this work made with the University of Saint-Etienne and with the fellowship of SNECHO-MG, the National Society of Sonography in general practice. So, ultrasound is increasingly used in general practice worldwide, as you know. I think we can go fast for that. Despite this growing interest, there is heterogeneity regarding what general practitioner should learn, what examination they should perform, and which competencies they should master. While several studies have proposed lists of ultrasound applications, there is no competency framework specifically designed for general practice. Therefore, the objective of our study was to identify the competencies expected of general practitioner performing ultrasound and to identify the clinical situation in which these competencies are applied. So, yes, I used the AI for this presentation. We conducted a systematic review prospectively registered in Prospero, and we followed the PRISMA guidelines. Research in Web of Science, Cochrane Library, and PubMed for consensus studies published between January 2015 and December 2025. Eligible studies included a community-based general practitioner using ultrasound in routine practice, and two independent blinded investigators screened studies and extracted data. Competencies and clinical situation reaching consensus were extracted and grouped using an inductive categorization approach. Discrepancies were resolved with two other additional researchers. Our research identified 184 records, and after screening and eligibility assessment, 7 studies were included in the final review. This study comprised 6 Delphi studies and 1 expert consensus statement. Most studies come from European countries. We identified 78 clinical situations considered relevant for ultrasound use in general practice. These situations were grouped into 9 anatomical families. These families included pulmonary, cardiovascular, abdominopelvic, gynecological, and obstetrical, musculoskeletal, superficial soft tissues, and all the protocols and guided procedures. Regarding competencies, we identified 19 competencies descriptors that converged towards 4 overarching competency domains. The first one was professionalism. This included selecting appropriate indications, recognizing the limits of one's expertise, maintaining competencies, documenting examinations, and applying safety standards. The second one was patient-centered care. This involved informing patients, obtaining consent, integrating ultrasound findings into clinical reasoning, and guiding management decision. The third one was image acquisition. Competencies included understanding ultrasound physics, mastering equipment, performing systematic examination, acquiring representative images, and performing appropriate measurement. And finally, the last one, image interpretation. This involves recognizing normal anatomy, identifying common pathologies, understanding artifacts, describing findings, and proposing differential diagnosis. Our finding identified 19 competency descriptors grouped into 4 core competencies and 78 clinical situations organized into 9 anatomical families. This is not... Sorry. Who put the button back just above the button? Sorry. So another important finding is the lack of standardization in ultrasound education. Previous studies have shown considerable variation in training duration, content, assessment method, and expected proficiency level. This variability may partly explain the difficulties encountered when implementing ultrasound training programs in primary care. Our proposed framework may therefore provide a common educational language for curriculum developers, educator, and professional organization interested in competency-based ultrasound educational. What we have to do now, future research should validate and refine this framework through broader international consensus, process and studies exploring how these competencies are mobilized in real-world practice. Thank you very much.